Hello, good afternoon, good morning, and good evening, everyone. We are back for another Ask WHO Social Media Live Q&A. My name is Yanowit Deshpanyawat, and I will be your host for today's session live from Geneva, Switzerland. If you follow us on social media, yesterday we celebrated World Food Safety Day on the 7th of June, and that's why we are here today with you to talk about food safety and get some of your questions answered. And it is my pleasure to have with us in the program today the Director of WHO Nutrition and Food Safety Department, Dr. Francesco Branca. Welcome, Dr. Branca. How are you doing?
Welcome. Thank you very much. Good afternoon. Very well. Thank you.
Great. All right. Dr. Branca, to start with, let's do a basic question because we have seen from our social media monitoring yesterday, a lot of people left a comment asking what is food safety exactly and why is it important to all of us?
Well, we want to eat food that is not only healthy, but it's safe. We say if it's not safe, it's not food. We need to have safe and nutritious food to sustain life and promote good health. The food can be unsafe for many reasons. It can be unsafe because there are harmful bacteria, viruses, parasites, or chemical substances. And unsafe food can cause more than 200 diseases, from diarrhea to cancers, of course, depending on the amount and the circumstances of the exposure. And nobody's exempt. 1 in 10 people get sick every year. So it's 600 million people every year getting sick, we estimate. And over 400,000 die as a result of these diseases, among which 125,000 children under 5. It's a very important cause of mortality for children under 5, diarrhea. And even it has a very important economic impact. Over $110 billion are burned as a result of the consequences of unsafe food. We want to eat food which is safe, and we wouldn't go to a restaurant if we know that it serves unsafe food. So even trade, the economy, tourism are affected by unsafe food. And we get the food from all over the world. So we want all the import rules to guarantee that the food we get on our table is safe. So all of that is food safety.
Oh, thank you very much. That's a great introduction. But before I get back to you, Dr. Branca, let me also welcome our viewers who are joining us from all around the world. Our focus today is on food safety, of course. Any questions related to this topic are most welcome. To ask your question on Twitter, use hashtag AskWHO in your tweet. And those of you who are watching us on Facebook and LinkedIn, simply leave your question in the comment section. We have a whole team monitoring and curating your questions, so do not miss your chance to ask us anything food safety. So while we are waiting for the questions from our viewers to come in, let's touch base on the World Food Safety Day, which we celebrated yesterday. Dr. Branca, could you tell us more about the theme of this year's World Food Safety Day? What are the key objectives, the key focus, and so on?
Well, first of all, the World Food Safety Day is a relatively recent celebration we have. It was established 3 years ago by the United Nations, and both WHO and FAO work together to advocate for the importance of food safety all over the world, and it really calling for those who are in power to address the current and emerging food safety challenges. So this year we're saying safe food now for a healthy tomorrow, meaning that food safety is so important for the next generation and for development in general. This is a very special year, as we all know, in many regards. And at the time when we've had restriction and we've had challenges and we've seen how fragile the food system is, we needed to think of the future. We needed to think on how to even take this opportunity and these challenges to rebuild our food system and make it better, such as to provide healthy, nutrition, and safe food to all the people in the world. There's a lot of people who cannot afford healthy, safe food. And about 3 billion people in the world cannot afford that healthy food. We need to change that. This is the time to build back better and to build a food system which is sustainable economically and sustainable for the planet. I mean, we are addressing the challenge of have a food system which is producing itself a big impact on the environment, whether it's the emission of greenhouse gases, whether it's the use of fresh water, whether it's too much use of land, whether it's actually contaminating land with excess pesticides, or even using antibiotics or antimicrobials in the wrong way for rearing animals and then creating antimicrobial resistance. So this is World Food Safety Day. It's an opportunity to think on how we reshape the food system given these challenges.
Oh, that's impressive to hear. Thank you. All right, I saw some nice questions are now popping in, but before we take the first question, Dr. Branca, we just talked about why food safety is important and its great benefits to people, the planet, and the economy. Could you tell us perhaps what are some of the major foodborne diseases related to unsafe food again, and who is the most vulnerable to these diseases if food safety is not ensured or if it's not there?
Yeah, I started off by saying, nobody's exempt really. So it's high-income countries, low-income countries. But it's true that low-income countries are more affected, and the most vulnerable people are more affected. Children, elderly people, they are more affected. In terms of which diseases, I mean, there are different groups. We talked about diarrheal disease agents, and you're probably familiar with Salmonella. Or another bacteria which is called Campylobacter. These are very common, and these are causing diarrheas. And this is more than half of the foodborne diseases. Then we have about a quarter, which is other infectious diseases agents, and about 20% which are parasites. The parasites you get, for example, in contaminated meats in areas where there's no veterinary control of animals. And there's a small percentage, perhaps less than 5%, with contamination from chemicals, toxins. The kind of toxins you get, for example, by storing grains too long. In Africa, we have the big problem of aflatoxins that are damaging liver and probably affecting growth. Or also we have in some fish or other seafood certain toxins which need to be removed before we eat the food. Or even you're familiar with toxic poisonous mushrooms. But then we put a lot of contaminants in the water and the soil that unfortunately get into our food. Such as, for example, the dioxins that can get into food, or certain heavy metals like lead, cadmium, mercury, that, for example, get in fish. We are trying to also anticipate the challenges that can come from different in new production, for example. We're concerned about the way food is packaged, and for example, the plastic used in packaging, and the waste that comes out of the plastics when they are left without adequate dealing. The microplastics. We're looking at that. These are not at the moment the biggest issue, but also because we are only relatively aware of its load. We're actually updating the analysis of the burden of disease, and to get more data and to really reassure people that the food they're getting on their table is safe.
Thank you very much, Dr. Branca. And then thank you, everyone, for sending us in questions. Seeing the first one here, and this could be, I'll follow up from what you've just said. One of our viewers is asking on Facebook, how can we assure that farmers don't use a lot of chemicals in spraying crops?
The amount which is acceptable is established by the international body called Codex Alimentarius. What WHO does together with FAO is, studying all the evidence about all these new compounds that are used in agriculture to indicate the amounts that are safe. So the unsafe compounds are not allowed. And then the Codex Alimentarius indicates what are the acceptable amounts. And then, of course, it's up to the national agencies to control the implementation. There are good agricultural practices, so it's perfectly safe to use certain amounts of agrochemicals. Of course, there should be no use of unauthorized chemicals, and they should be no excess use. The chemicals are important because they can protect the crops. And in absence of the use of a certain amount of safe chemicals, we would probably have a problem of food security. So I think we can trust the authorities that are able to control the use of agrochemicals in our food systems.
Okay, thank you very much. And we have a more interesting question from Facebook. Always, what is the best solution for nutrition and safe food for children who live in poverty?
Well, of course, poverty is a major challenge. I was saying that there's about 3 billion of people that cannot afford a healthy diet. And even looking at the more extreme forms of really undernourishment, we have over 800 million people who live in this condition. So this is still really a major challenge for development. The ambitious objective of zero hunger is far, and COVID-19 has made things worse. Has actually probably increased the number of people with that. Now, the solutions are first and foremost in the establishment of adequate social protection systems. We need that, and many countries, even in high income, are looking after their poor people, and they should do that not giving the leftovers, but giving adequate, good, and safe food. So social protection, which can be done either with direct food aid, canteens or food aid, but also by giving cash and creating job opportunities. That was, for example, what some of the international agencies, such as the World Food Programme, do, to provide those cash opportunities so that people are able to buy their food. Food is, by and large, not very expensive when it comes to staple food. Grains are not very expensive, but when it comes to a healthy diet, that becomes more expensive. So we need also to do something on the aspect of the price of food, and making sure that the healthy food, particularly the fruit and vegetables, sometimes the animal source food, become more accessible. And that can happen with adequate action, investment by the governments to make those healthy foods, more accessible to all. Often, it's not only about poverty, it's about the places where poor people live. If poor people live in an environment where there's no shop that is selling food which is contributing to a healthy diet, but is only living in neighborhoods where you have, perhaps cheap, fast food, manufactured food, they perhaps can buy the food, but they will also develop some forms of malnutrition, whether it's vitamin and mineral deficiencies or obesity. So they're also going to suffer. So it's necessary to have good social protection, but also a good policy of food availability and accessibility.
Well, thank you very much. That's perfect, because going back to yesterday, our Director General, Dr. Tedros, mentioned in his opening remarks during the World Food Safety Day event that food safety is everyone's business. It'd be lovely if you could elaborate on that for us. Who is the decision maker when it comes to safe food production and consumption?
Yeah, it is a collective responsibility. You need to think of the food system as a whole chain. Where food is, plants are grown and food is produced, or animals are farmed or caught, and there's a distribution and transformation, and then food eventually lands in shops, supermarkets, markets, fresh food markets, and then get to our table. And we don't necessarily eat it immediately. I mean, it takes some time. We need to keep it somewhere. So there are a lot of critical points in all this chain, and each of those points requires attention. So first and foremost, of course, the government, the policymakers, but government need to set rules. They need to set the rules for as we're saying, the standards of good agricultural practices. They need to set the rules for quality of food that can be imported, for example. They need to set up the food control systems that are able to indicate whether a certain lot of food, for example, is safe or contaminated. So government. Then the manufacturers at all levels, from the farmers, we're talking about the right use of agrochemicals, but also those who are able to distribute food. I mean, if you think that some of the food, the grains we eat, goes around the world, and if it's kept too long, it develops mold, for example. So those actors are also important, and then of course manufacturers, that have to use safe manufacturing practices, industry that needs to use only the right preservatives, additives, and need to make sure that, for example, in the whole cold chain for food that needs to be refrigerated, the temperature never goes down. But of course, shop owners, and that's why we have expiry dates on product, and shop owners should make sure that we don't get offered the products beyond expiry date. But then it's us because if we bring the food which is safe in a place which is unclean, for example, or if we prepare it in a way that it's unclean, or if we keep it for example outside the refrigerator, then bacteria will contaminate. So basically, it's a whole chain, and it's a lot of collaboration that's required among these actors to agree on what these safe rules are.
Oh, thank you very much. So it's everyone's business. Governments, producer, business operators, consumer, and everyone. So just a reminder for all of you who just joined us, our program today is on food safety. We have Dr. Francesco Branca to answer all of your questions. You can send over your question or anything that you wanted to share with us using hashtag AskWHO on Twitter, or leave your question in the comment section if you're watching us on Facebook or LinkedIn. All right, I think now everyone who is watching us might ask, what exactly can individuals do to keep their food safe? So perhaps you could tell us what's the easiest way to prevent food contamination.
Yes, and I actually encourage everybody to look at the WHO 5 keys to safer food. They're easy to remember, and we've done some materials to remind everybody about 5, like the 5 fingers. First of all, keep clean. Wash your hands before you prepare food. Wash your fruit and vegetables. Cleanliness, simple cleanliness. Of course, you need to use fresh water, and places that do not have fresh water have a challenge there. Second, always separate the raw from the cooked. In the refrigerator, use 2 separate areas. Never mix them, the raw with the cooked, because the raw can recontaminate the cooked. Third, cook thoroughly. Make sure that particularly animal products, you need to cook well enough to eliminate any potential contamination. There is always a little bit, sometimes on meat, on eggs, and you don't want this to proliferate. So cook thoroughly. Number 4, you have to keep food at safe temperatures. So once food has been cooked, it can stay in the refrigerator for a certain time. certain foods needs to be frozen, and you need to make sure that you place those food in the right part of your refrigerators, and also that those refrigerators work and they have the right temperature. So the right temperatures are really important. And fifth, use safe water and raw materials in general. So that's why it's important that when we go to the market, we also look around and see, is this market really, clean, and are they not mixing, the waste and the good food, or is the animal section too close to the fruit and vegetable section? We advocate for a separation of those. But so you as a consumer should also have a look at what you buy, and fish, meat, have a look at the colors and the taste. So all those elements are important.
Thank you very much, Dr. Veronica. All right, everyone, I just want to repeat one more time. There are 5 keys to safer food. 1, keep clean. 2nd, separate raw and cooked. 3rd, cooked roughly. 4th, keep food at set temperature. And 5, use safe water and raw materials. These are very easy steps to follow. So here are quite a few questions coming in now. So let's take some of them. The next question is pretty interesting, and as we are still living in a global pandemic of COVID-19, one of our viewers is asking, what are the changes in food safety management with the COVID-19 public health measures in place? And perhaps also you could tell us what role food safety plays in the time of COVID, and how we can, make sure that food that we buy at the market or at the supermarket are safe during this COVID situation.
So something I need to repeat, we've been saying it throughout the COVID epidemic. COVID is not transmitted by food. It has been found on frozen food in small amounts, but it doesn't transmit. It's absolutely safe to eat food from the COVID point of view. Of course, during the COVID, we saw a lot of challenges to the food system. First and foremost, because workers got sick, and the circulation of workers was also restricted, and so people, could not go and pick up the crops. So we've lost a lot of fresh crops in many countries because of that. Transporters were affected. So those kind of challenges we had. But then we, together with FAO, we immediately developed some guidelines for food operators to make sure that food safety is not given up during these circumstances, and guidelines for the Food Safety Authority to guide and prioritize food controls, even in a situation where perhaps they were restricted. The staff was not all there, but basically we were recommending never to give up the food control. It would have been an additional disasters to give up those food controls. So, and then the guidance also for supermarkets. I mean, you all now go to supermarkets with a face mask. You always wash your hands or use sanitizer before you enter the supermarket, and then you clean thoroughly the food carts. I mean, all those precautions are important. Of course, the number of people in food markets and in supermarket, that's been an important one, and the queue that we have seen, those have been very important measures, but that has not had negative consequences on the safety of food from other points of view.
Thank you, Dr. Veronica. Okay, we've got an interesting question from LinkedIn viewer. He or she is asking, is there recommended temperature to prevent food contamination, particularly in countries with hot weather?
Well, it depends, of course, on the kind of products, but normal refrigeration would work for most food. Normal refrigeration is about 5 degrees centigrade. then that allows you to keep food for a couple of days or 2-3 days. And then, of course, you would need freezing temperature less than 20 degrees for longer periods. But usually you have this directions on the packaging of food, and this is of course valid in all countries and at all temperatures. So you should read the label. I mean, the label should always have those kind of indications.
Thank you. So here's another question from our viewers on Facebook asking, countries having different standards of export quality, any action from the WHO on that?
Yeah, that's a very important element, actually. In fact, probably food trade is a good driver of food safety, because you know how things work. I mean, there are certain standards established in a country or in a region. In the case of Europe, the whole European Union has certain food standards, and this is about the presence of certain contaminants. It's about the sourcing of food and the control that are done. So there are strict demands on imports. Those demands tend to be standardized. They are standardized through the Codex Alimentarius, because at the same time, countries should not use this regulation as technical barriers to trade. So trade should be facilitated with keeping this good standards. And for this to happen, there are usually very well-equipped laboratories at the customs. In fact, we work very closely with the customs services to make sure that they have laboratories, for example, to do the analysis of food. They take samples of food. So circulation of good is actually a good way to ensure food safety, because of course this is about all the manufacturing practices and about packaging and transporting. So as we were saying earlier, all the value chain needs to be equipped to do that. So if a country wants to produce and export, they need to ensure that they have good systems. So by doing that, for example, all countries who want to, export to the European Union have to have a system in place for their food to be, adequately guaranteed, so that it's not blocked and at the customs. And if food is blocked, is returned, and that's an enormous economic loss. So trade is a very important driver for better food safety.
Thank you. Before we take some last questions from our viewers, I just want to ask you, could you tell us what WHO roles in the global food safety, or basically what WHO has been doing to support countries to ensure food safety for all?
Well, first and foremost, WHO establishes this standards for safe food. We're working together with the Food and Agriculture Organization with a series of scientific committees that advise the Codex on pesticide residues, on food additives, on microbiological risks, on emerging challenges. So we take all the science together to do what we call the risk assessment for all these elements. Then we help countries set up their food control systems, build the capacities, help setting up laboratories, setting up monitoring systems. So that's really important. And last year, the World Health Assembly, which is the body that is convened by the World Health Organization with representative of all ministries of health, asked us to develop a global food safety strategy in collaboration with FAO and the Organization of Animal Health. That is basically calling for 5 things to be done to improve food safety globally. Number 1, strengthening national food controls. Number 2, identifying and responding to food safety challenges that result from global changes and transformation in food system. Third, increasing the use of food chain information, scientific evidence, and risk assessment in making risk management decisions. The whole understanding about tracking the food to understand its sort of pedigree. Number 4, strengthening stakeholder engagement and risk communication, making sure that really all those who have to know about this are involved. And 5th, promoting food safety as an essential component in domestic and international food trade, as we were discussing. So WHO is helping with all of that. So basically, giving the tools to countries and help them implement adequately food safety. We're also doing a bit more now on the reassessment of the foodborne disease burden, because we need to really be clear about what is the health impact of unsafe food.
Thank you, Dr. Branca, for explaining this to us. All right, I would take 1 or 2 more questions before we end our session. Here is an interest. Actually, we got a lot of questions regarding packaging and plastic packaging. So, can food packaging be toxic? And the other question is, how effective is plastic packaging towards food safety?
Packaging is also used and considered, and we're looking at the exchanges between the packages and the food. So it's the authorized packaging is not toxic. That you can be sure there. But there are continuously new materials that are evolving. Also to improve sustainability. So we're trying to get packaging that at the same time preserves the food adequately, but then doesn't create an impact on the environment. We're trying to give up the different kinds of plastics, for example. So packaging is important, and it's again regulated by adequate with adequate risk assessment being done.
Thank you. All right, I see that we are running out of time now. I have just one last question to ask you. So, what is the future of food safety? What could we expect in the years to come?
It's a very interesting question, because, of course, we need to understand how the world is changing. First of all, we'll be 10 billion in 2050. So we need to produce much more food. We need to, now it's 7 million to 10 million. So it's about half more the food. And that food needs to be produced in a way that is not creating an enormous impact on the environment, staying within the planetary boundaries and being safe. We also are going to live more in cities, which means that food will be more and more packaged. We will have more elderly people, which means we will have more vulnerable people around. So these are all things that are going to be considered. We're probably going to use different food sources. We will need to use more marine sources. I mean, the blue food is the future of food. We will use new technologies. We will rely, for example, on the insects. So we are going to have new challenges and maybe new processing. For example, the use of nanotechnologies to better separate the elements of the food. All of that needs to be assessed. But also, we need to make sure that we use what we call the One Health approach. So we do not create a conflict between our needs and the needs of the environment and of the animals. Our health and their health are connected. And if we affect the environment, as we're doing with, for example, deforestation or extraction industry, and not considering the impact that happens, we're displacing animals. The animals are getting in closer contact with the humans, and the risk of infectious diseases is increasing. Remember that 75% of the emerging infectious diseases in the last 20 years have come from animals. So the way that food system is going to be very important, and we have new challenges, but also new opportunities, because we're understanding those complexities, and we're able now to rebuild our food system, with the recovery in a way that is actually addressing all these issues simultaneously. This year, we're going to have a UN Food System Summit convened by the Secretary General of the United Nations, and everybody is involved. It will be convened in September, but meanwhile, there are so many groups and constituencies coming up with solutions to make our food system better and to provide healthier and safer food to all.
I'm sorry, I was muted. Hi, thank you very much, Dr. Branca. That's a very nice point to end on. All right, if you want to learn more about WHO work around food safety and safe food practices, please visit our website, www.who.int, or go visit our TikTok account at WHO. We have some tips for you on how to keep food safe, and there you can join the Keep Food Safe Challenge by duetting our videos using one of the tips to save for food. We will put all the links down below so you can go check it out directly after this live. And thank you everyone for tuning in from all over the world. So I'm gonna shout out to some countries here: Ireland, India, UK, Tanzania, Switzerland, Netherlands, Albania, Kenya, Nepal, Tunisia, Mozambique, Nigeria, USA, Mali, Brazil, Haiti, Costa Rica, Sweden, Canada, Cyprus, Portugal, Mexico, Indonesia, Laos, Kenya, Liberia, Scotland, Singapore, Nigeria, Argentina, and many others. Thank you everyone for tuning in. Thank you for celebrating and supporting food safety with us. And thank you, Dr. Branca, for taking the time to talk to us today. I really appreciate it. It was a very interesting discussion. Please stay tuned or follow us if you haven't already on our social media platforms for upcoming activities. But for now, if you love food, keep food safe and stay healthy. Go check out food safety tips on WHO TikTok account, and see you next time. Bye-bye.
Thank you. Goodbye.